Have you ever noticed how your grandmother, your mother, or even you yourself seem to get urinary tract infections more frequently as the years go by? And it feels like no matter what you do, these infections keep coming back like an uninvited guest? Maybe you've tried drinking more water, changed your hygiene habits, taken countless antibiotics, and still that burning sensation returns, making you feel trapped in a cycle that seems endless. What if I told you that there's one single fruit, something so simple and accessible that you probably have in your kitchen right now, that could be the missing piece in your fight against recurrent urinary tract infections, especially as we age? This isn't about a miracle cure or an expensive supplement. This is about science, real studies, and a natural solution that has been changing the lives of thousands of older adults around the world. Before we dive deep into this revelation, I need you to do something for yourself right now. Click that subscribe button and turn on the notification bell, because what you're about to learn could completely transform your relationship with urinary health. By subscribing, you're joining a community of people who are tired of suffering in silence, who want real answers, and who deserve to live without the constant fear of another infection. Every video on this channel is designed to give you the tools that many doctors don't have time to explain in a rushed appointment. So subscribe now, and let's start this journey together toward a life free from the discomfort of urinary tract infections. Now, before I reveal which fruit we're talking about, I want you to understand something crucial. As we age, our bodies go through changes that make us more vulnerable to urinary tract infections, and it's not your fault. After the age of 50, especially in women who have gone through menopause, the decrease in estrogen levels causes the vaginal and urinary tract tissues to become thinner and drier, creating the perfect environment for bacteria to multiply. In men, prostate enlargement can cause incomplete bladder emptying, leaving residual urine that becomes a breeding ground for infection. Add to this a naturally weakening immune system with age, medications that affect bladder function, and mobility issues that can make proper hygiene more difficult, and you have a perfect storm. Studies show that up to 10% of women over 65 experience at least one urinary tract infection per year, and this number jumps to nearly 30% in women over 85. For men, while less common, the rates increase significantly after age 60. These aren't just numbers. These are real people suffering real pain, canceling social activities, living in fear of the next flare-up, and spending hundreds or even thousands of dollars on repeated doctor visits and antibiotics that often come with their own set of unpleasant side effects. The fruit I'm about to reveal to you has been studied extensively by researchers at Harvard Medical School, the University of Michigan, and several European institutions, and the results are nothing short of remarkable. But before we get there, I want to share with you the story of Margaret, a 68-year-old retired teacher from Ohio who had been suffering from recurrent urinary tract infections for nearly 5 years. Margaret told me that she was getting an infection every 2 to 3 months like clockwork, and each time it happened, she knew the drill. The burning sensation would start, then the constant urge to urinate, the pain in her lower abdomen, and sometimes even blood in her urine. She had been to her doctor so many times that she had lost count, and each visit ended the same way with another prescription for antibiotics. The problem was that the antibiotics were starting to lose their effectiveness, a phenomenon doctors call antibiotic resistance, and Margaret was running out of options. She had tried cranberry pills, D-mannose, supplements, increased water intake, probiotics, and even changed her entire diet. But nothing seemed to break the cycle. She was starting to feel hopeless, wondering if this was just going to be her life from now on. Then, during a routine appointment with a new urologist, she learned about this particular fruit and decided to give it one last try. Within 3 months of incorporating this fruit into her daily routine, Margaret went from having an infection every few weeks to going 6 months without a single episode. Today, nearly 2 years later, she's had only one minor infection that resolved quickly, and she attributes her transformation entirely to this simple dietary change. The fruit we're talking about is the pineapple, and before you think this sounds too simple or that you've never heard this before, let me explain exactly why pineapple is a game changer for urinary tract health in older adults, especially when it comes to prevention. Pineapple contains a powerful enzyme called bromelain, which is found primarily in the stem and core of the fruit, though it's also present throughout the flesh. Bromelain has extraordinary anti-inflammatory properties that work in multiple ways to protect your urinary system. First, bromelain reduces inflammation in the urinary tract lining, which is particularly important for older adults because chronic low-grade inflammation is one of the main factors that makes the bladder and urethra more susceptible to bacterial infection. When your urinary tract tissues are inflamed, they become more permeable, allowing bacteria to attach more easily and penetrate deeper into the tissue layers. By reducing this inflammation, bromelain essentially creates a less hospitable environment for harmful bacteria. Second, and this is where it gets really interesting, bromelain has been shown in laboratory studies to break down the biofilms that bacteria create to protect themselves. These biofilms are like invisible shields that bacteria build around themselves, making them resistant to both antibiotics and your immune system's attacks. This is one of the main reasons why urinary tract infections become recurrent, because some bacteria survive the antibiotic treatment by hiding in these biofilms, only to emerge later and cause another infection. Bromelain disrupts these protective structures, making the bacteria vulnerable again. Third, bromelain enhances the effectiveness of antibiotics when they are needed, which means that if you do get an infection, the treatment is more likely to work completely and prevent resistance from developing. But the benefits of pineapple for urinary health don't stop with bromelain. Pineapple is incredibly rich in vitamin C, with just 1 cup of fresh pineapple, providing about 79 milligrams, which is nearly 90% of the daily recommended intake for older adults. Vitamin C is crucial for urinary tract health because it acidifies the urine, creating an environment where most harmful bacteria, particularly E. coli, which causes about 85% of all urinary tract infections, cannot thrive. E. coli prefers a more neutral or alkaline environment, so when your urine becomes more acidic, it's like turning up the heat in a room where these bacteria can't survive. Additionally, vitamin C is a powerful immune booster, strengthening your body's natural defense mechanisms against infection. As we age, our immune systems naturally decline, a process called immunosenescence, and this makes us more vulnerable to all types of infections, including those of the urinary tract. By providing high doses of vitamin C, pineapple helps to counteract this age-related immune decline. The fruit also contains significant amounts of manganese, a trace mineral that many older adults are deficient in, which plays a crucial role in bone health, wound healing, and metabolic function. While manganese doesn't directly prevent urinary tract infections, it supports overall health, which in turn supports your body's ability to fight off infections when they do occur. Let's pause for a moment. I want to ask you something personal, and I promise it's not invasive, but rather liberating. How many times have you felt that burning sensation, that constant urge to run to the bathroom, and you've kept it to yourself, not wanting to bother anyone? Not wanting to admit that this problem has taken over your life? It's as if people don't really understand what you're going through. As if they think it's just a minor inconvenience when in reality it affects every aspect of your day, from your sleep to your social life to your confidence. This feeling of isolation can be just as painful as the physical symptoms themselves. If you identified with what I'm saying, I want to invite you to share your experience in the comments right now. It can be something simple like, I've been dealing with recurrent infections for X years, and I never knew pineapple could help. Or, I've tried everything, and I'm ready to give this a chance. Your comment might seem small to you, but for someone else reading it, someone who is suffering in silence just like you were, it could be exactly the encouragement they need to take action. You are not alone on this journey, and your story can help build the support network that many of us never had. Comment now while this feeling is present, and let's break this silence together, because silence only makes the suffering worse. Now let me share with you exactly how to use pineapple for maximum benefit, because simply eating a slice here and there isn't going to give you the results you're looking for. The key is consistency and the right amount. Research suggests that consuming about 1 to 1.5 cups of fresh pineapple daily provides enough bromelain and vitamin C to make a significant difference in urinary tract health. This translates to roughly 150 to 200 grams of pineapple per day. You want to eat it fresh whenever possible. Because the bromelain content is highest in raw pineapple, and cooking or processing can significantly reduce its effectiveness. If fresh pineapple isn't always available or convenient, frozen pineapple is the next best option, as long as it hasn't been sweetened or processed with additives. One of the most effective ways to consume pineapple is to include the core in your intake, even though it's tougher and less sweet than the flesh. The core contains the highest concentration of bromelain, so many people cut the core into small pieces and blend it into smoothies where the texture becomes less noticeable. A powerful morning routine that many of my community members swear by is a pineapple smoothie made with 1 cup of fresh pineapple, including some core, half a cup of plain yogurt with live cultures for additional probiotic benefits, a handful of spinach for extra vitamins and minerals, and a squeeze of fresh lemon juice for even more vitamin C. Blend this together with a little water, or unsweetened coconut water, and you have a urinary tract health powerhouse in a glass. It's important to understand the timing and what to expect. Unlike antibiotics that work within hours to days, pineapple is a preventive strategy that works gradually to change the environment in your urinary tract and strengthen your immune system. Most people who follow a consistent daily pineapple routine notice a reduction in infection frequency within 2 to 3 months. This might sound like a long time, especially if you're suffering right now, but think about it this way. If you're currently getting an infection every month or two, and after 3 months of eating pineapple daily you go 6 months or a year without an infection, that's a life-changing improvement. The goal isn't necessarily to never have another urinary tract infection ever again, although some people do achieve that, but rather to drastically reduce the frequency and severity of infections, reduce your dependence on antibiotics, and improve your overall quality of life. Some people report that when they do get an infection after starting the pineapple routine, the symptoms are much milder and resolve more quickly, even without antibiotics in some cases, though you should always consult your doctor before deciding whether to treat an infection. Let me tell you about Robert, a 72-year-old retired engineer from Florida who had a different but equally challenging situation. Robert had an enlarged prostate, a condition called benign prostatic hyperplasia that affects most men over 60 to some degree. This enlargement was causing incomplete bladder emptying, and the residual urine in his bladder was leading to frequent urinary tract infections, sometimes 3 or 4 times a year. His urologist had discussed surgery as an option, but Robert wanted to try other approaches first. Along with medications to help shrink his prostate and improve urinary flow, Robert started eating pineapple every single day, usually as part of his breakfast. He would cut up a quarter of a fresh pineapple, including pieces of the core, and eat it with his morning oatmeal. His wife started making him fresh pineapple juice a few times a week, always keeping some of the pulp and core in the juice to preserve the bromelain. After about 4 months, Robert noticed he was making it through his regular checkups without any signs of infection. His urologist was impressed and encouraged him to continue whatever he was doing. That was 3 years ago, and Robert has had only 1 infection since then, compared to the 3 or 4 per year he was experiencing before. He still takes his prostate medication, but he credits the pineapple with being a crucial part of his infection prevention strategy. There are some important considerations and potential concerns you should be aware of before adding large amounts of pineapple to your diet. First, pineapple is relatively high in natural sugars, with about 16 grams of sugar per cup, so if you have diabetes or are watching your blood sugar levels, you need to account for this in your daily carbohydrate intake. The good news is that pineapple also contains fiber, which helps slow the absorption of sugar, and when eaten as part of a balanced meal rather than on an empty stomach, the impact on blood sugar is less dramatic. If you're concerned about the sugar content, you can reduce the portion size slightly and compensate by taking a bromelain supplement, which I'll discuss in a moment. Second, because bromelain has blood-thinning properties, if you're taking anticoagulant medications like warfarin, aspirin, or other blood thinners, you need to talk to your doctor before adding large amounts of pineapple to your diet. The combination could increase your risk of bleeding. Similarly, if you're scheduled for surgery, you should stop eating large amounts of pineapple at least 2 weeks before the procedure. Third, some people experience mild digestive upset when they first start eating pineapple regularly, particularly if they're eating the core, which is high in fiber and enzymes. This usually resolves within a week or 2 as your system adjusts, but if you experience significant discomfort, You can start with smaller amounts and gradually increase over time. For those who find it difficult to eat fresh pineapple every day, either because of availability, cost, or personal preference, bromelain supplements are an alternative option. These supplements are widely available in health food stores and online, and they provide concentrated doses of the active enzyme without the sugar content of the fruit. A typical therapeutic dose for urinary tract health support is 500 to 1,000 milligrams of bromelain per day, taken on an empty stomach for maximum absorption. Look for supplements that list the enzyme activity in GDU, which stands for gelatin dissolving units, or MCU, which stands for milk clotting units, as these indicate the potency of the bromelain. A quality supplement should have at least 2,000 GDU or 1,200 MCU per gram. However, I always encourage people to try the whole fruit first if possible, because you're not only getting bromelain but also vitamin C, manganese, fiber, and a host of other beneficial compounds that work together synergistically. Nature often packages nutrients in combinations that are more effective than isolated supplements. Plus, there's something psychologically empowering about making a positive health choice every day by eating something delicious, rather than just taking another pill. Beyond just eating pineapple, there are other complementary strategies you can combine with this fruit to create a comprehensive urinary tract infection prevention plan. Hydration remains absolutely critical, and I cannot stress this enough. You should be drinking at least 6 to 8 glasses of water per day, and I mean actual water, not coffee, tea, or juice. Water helps flush bacteria out of your urinary system before they have a chance to multiply and cause infection. Many older adults don't drink enough water because they worry about having to use the bathroom frequently, or they simply don't feel as thirsty as they used to due to age-related changes in thirst perception. But adequate hydration is non-negotiable for urinary health. If you struggle to drink plain water, you can infuse it with fresh pineapple chunks, cucumber slices, or mint leaves to make it more appealing. Probiotics are another powerful tool, particularly strains like Lactobacillus rhamnosus and Lactobacillus reuteri, which have been shown in clinical studies to colonize the urinary tract and prevent harmful bacteria from taking hold. You can get these probiotics from fermented foods like yogurt, kefir, sauerkraut, and kimchi, or from high-quality probiotic supplements. Proper bathroom habits are also essential, and this is something many people don't realize they're doing wrong. You should urinate whenever you feel the urge rather than holding it in, because retained urine gives bacteria more time to multiply. After urinating, women should always wipe from front to back to prevent bacteria from the anal area from being introduced to the urethra. Both men and women should urinate shortly after sexual activity, as this helps flush out any bacteria that may have been introduced. For women who are postmenopausal, vaginal estrogen cream prescribed by a doctor can help restore the health and thickness of vaginal and urethral tissues, making them more resistant to infection. Let me share one more story that I think will resonate with many of you. Linda, a 74-year-old grandmother from Michigan, had been dealing with recurrent urinary tract infections for almost a decade. She had become so accustomed to the cycle of infection, antibiotics, temporary relief, and then another infection that she had almost accepted it as her new normal. The infections were affecting every part of her life. She stopped traveling to visit her grandchildren because she was afraid of getting an infection while away from home. She stopped going to her weekly book club meetings because she never knew when an infection would strike. She even stopped gardening, which had been her greatest joy for over 40 years, because bending and kneeling seemed to trigger infections. Linda had tried cranberry juice, cranberry pills, demon nose powder, increasing her water intake, changing her underwear, fabric, changing her laundry detergent, and even eliminating certain foods from her diet, but nothing made a lasting difference. She had spent thousands of dollars on doctor visits, antibiotics, and over-the-counter remedies. When she first heard about pineapple for urinary tract health, she was skeptical, as she had been disappointed so many times before. But she was also desperate enough to try anything. She started by adding half a cup of fresh pineapple to her breakfast every morning, and after 2 weeks, when she hadn't noticed any immediate change, she almost gave up. But something told her to keep going. She increased her intake to a full cup per day, making smoothies with pineapple core, plain Greek yogurt, and a little honey. She also started drinking more water throughout the day and taking a probiotic supplement. After about 6 weeks, Linda realized something remarkable. She hadn't had an infection. 8 weeks went by, then 12, then 16. For the first time in nearly 10 years, Linda went 4 months without a single urinary tract infection. She was able to visit her grandchildren out of state. She rejoined her book club. She got back into her garden and spent hours planting flowers and vegetables. Linda told me that pineapple didn't just help her avoid infections, it gave her back her life, her confidence, and her sense of freedom. She's now been following her pineapple routine for 2 years, and she's had only 2 mild infections in that entire time, compared to the 6 to 8 severe infections per year she was experiencing before. If this video has opened your eyes to something you never knew before, if you're feeling hopeful for the first time in a long time, or if you're ready to take control of your urinary health naturally, then I need you to do something important right now. Subscribe to this channel and click the notification bell so you never miss a video. This channel exists to provide you with real, science-based solutions for health problems that affect your daily life. We're not about quick fixes or fad diets. We're about sustainable, evidence-based strategies that actually work. By subscribing, you're joining a community of people who believe that food can be medicine, that natural approaches deserve to be explored, and that you deserve to live without constant pain and discomfort. Every week, we publish new content about urinary health, digestive health, immune support, healthy aging, and so much more. Imagine having access to this kind of information whenever you need it, right at your fingertips. Subscribe now, turn on notifications, and let's continue this journey together toward better health and a better quality of life. Your body deserves this care, and you deserve to feel good again. Click that subscribe button right now, and let's make it happen together.